goes without saying that improving and maintaining your mental or physical health is always important, but that doesn't mean it's always affordable, easy, or fun. That's why Western Mass News reporter Tyler Beraldi is taking a look at a new program here in Massachusetts that's turning day trips into treatment.
You know, they say that music is medicine, at least when I'm not the one playing it. But did you know that here in Massachusetts, it can actually come with a prescription?
First introduced back in 2020, it's called Social RX, or a social prescription, a community-based intervention to provide a social connection.
The arts really bring people together. They help people understand, others' cultures. They help connect people across differences.
The Community Music School of Springfield is one option, but others include museums, theaters, and opera houses, and your provider could prescribe them.
So we try to pair our students with a teacher that matches their needs, their level, their personality, their genre interests, and then people typically take like a 30 to 60-minute private lesson.
The school's director of finance and operations, Sierra Simmons, tells us since the program first took off in 2020, she's seen firsthand the difference that something as simple as picking up an instrument can really make.
So we've noticed that people say they feel like they're making new friends, they're making new connections, they feel more connected, they feel less lonely and isolated.
And the evidence isn't just
you're familiar with that
either. I even spoke with Dr. Priscilla Wang, a primary care physician at Mass General Hospital, who broke down the concept that could turn your treatment plan from a doctor's office to an auditorium.
I'm sure they are enjoyable for hopefully many of us, but they can actually be a way of treating or ameliorating some of the symptoms of conditions that people experience, which can range from mental health challenges like depression, anxiety, to others like social isolation and its connections on other health conditions.
In 2023, then U.S. Surgeon General Vivek Murthy called loneliness and social isolation an epidemic. Research shows about 1 in 2 Americans has struggled with loneliness. And while just about everybody feels lonely from time to time, the longer that feeling lasts, the more the risk increases for it to become a physical problem.
People that don't engage their mind in different ways, that are more socially isolated, that don't change their environment, don't have access really to mental stimulation, they may experience worse outcomes. And we know that high blood pressure is connected to stress and anxiety as well.
The Centers for Disease Control and Prevention say that social isolation can increase your risk for heart disease, type 2 diabetes, dementia, and premature death. Still, Dr. Wang emphasizes that this program is more of a supplemental treatment plan than a substitution for traditional medicine. But if your care provider, like Mass General, works with the program, the experience might end up being covered.
Our perspective and how we work with community members, patients, is they never pay for anything. Those paying entities, healthcare payers, large healthcare organizations, colleges, universities, government entities, are the folks covering the cost for the patients and community members.
The head of strategic partnerships and clinical innovation at Social RX, Emily Devlin, tells us the biggest challenge now is expanding that access.
Our biggest goal, right, is trying to get this in the hands of as many community members as possible, as many patients, and ultimately educating folks about how amazing social prescribing can be.
If you're interested, start with your primary care provider. We also have a full list of participating Social RX experiences on our website at westernmassnews.com. Reporting in Springfield, Tyler Beraldi, Western Mass News.